If you have keratoconus, you might be considering cross-linking. This is Dr. Motwani from Cornea Revolution. Cross-linking is essentially a process to make more bonds in between the cells of the cornea, the keratocytes, the actual stromal cells that make up the structure of the cornea. The increased bonds, or the increased number of bonds between these cells, make the cornea more rigid. It makes it stronger. And when it does that, it prevents the cornea from protruding further. It doesn't reverse the progression, it just kind of stops it. And so that corneal cross-linking is accomplished by saturating the cornea in riboflavin and catalyzing a reaction with ultraviolet light. And the important part about this is there's really two types of cross-linking. Type 1 is epithelial off, and type 2 is epithelial on. Epithelial on, you just leave the epithelium, saturate the riboflavin, which takes quite a bit more time, and run the ultraviolet light, and it gets around 100, 110 microns of cross-linking out of a cornea that usually on a keratoconus patient is about 400 to 450 microns. So it only really gets about a quarter of it. Epithelial off cross-linking, you remove the epithelium because the epithelium is a barrier to the riboflavin actually saturating the cornea. And when you take the epithelium off, you actually increase the penetration to over 200. So now in that 400 to 450 micron cornea, you're really getting about half that cornea or a little bit more to actually be strengthened. And so that's good because epithelium off, you're not 100% sure that that's going to be enough to stop progression in everybody. What if it stops progression in 95% and the other 5% keep progressing? That's not so hot. Epithelium off, essentially you're removing tissue, the epithelium, just like a PRK, several days of healing. Probably the easiest procedure we do here is corneal cross-linking. Really isn't that difficult as long as you're taken care of properly with the right medicines afterwards and allowed to heal quickly.